Hi everyone, welcome back to another video, and today's topic is going to be a little bit intense because I know this can spark some very heated and emotional discussion because we're going to talk about abortion and pregnancy termination, and I know this can spark a lot of emotional conversation, and part of this is due to the propaganda and the arguments going out there in the political sphere, but I wanted to get in on this conversation because I feel like a lot of people don't understand what abortion is, what we mean by pregnancy termination, and hopefully you can take this information into conversations with people you know, or if you're on the fence yourself, you can take this information from the American College of Obstetrics and Gynecology and kind of maybe rethink your position a little bit, because we really are not talking about this in a very good way. In terms of the science, a lot of the terminology is misused. So I want to clear that up today, especially regarding timelines and with the terminology. And then in future videos, we'll talk about other issues related to this very heavily debated topic. So we're going to start off by talking about the timeline of gestation. And this is a pretty simplified timeline. We're not going to talk about it in a lot of detail, but we have some important milestones here listed out. So we have at the very beginning would be like day 0, where you have conception occurring, and then we have some more timeline spacing out. Of course, things occur earlier than 20 weeks, but we're specifically talking about what happens if you were to deliver or have a baby at this stage of pregnancy, and that's the most important thing with this timeline. So at 20 weeks and earlier, the fetus, or as we call it, the gestation, is non-viable. So if you were to end a pregnancy at 20 weeks or earlier, this would be not viable. The gestation would not be able to survive on its own outside of the womb. And then we get to 20 weeks to 28 weeks are called extremely preterm. And there's kind of a pivot point here at 24 weeks, which is why I have it starred, because once you hit 24 weeks, or the closer you get to 24 weeks, the more likely the gestation is to survive if pregnancy does not go through. If you are to deliver a baby at 24 weeks, it has a better chance, significantly better chance at surviving than if you are to deliver at 20 weeks. So this is why this is kind of a pivot point here. But either way, 20 weeks to 28 weeks is still kind of a sketchy area. You don't really want to deliver in this time frame. It is extremely preterm and definitely better to keep gestating at this stage. Then moving on from weeks 28 to 34. This is called early preterm, and there's some other points that ACOG will put between extremely preterm and early preterm. You can break this down further into very preterm, but I just wanted to keep it pretty simple. So we have extremely preterm, and then we have early preterm, and then we have from 34 weeks to 37 weeks, we have late preterm, because once you hit 37 weeks, you are now in term. So when we say a term pregnancy, term is anywhere from 37 weeks to 41 weeks, but this period from 37 weeks to 39 weeks is called early term because it's term and it's early. So early term is if you deliver between 37 and 39 weeks. Then 39 weeks to 40 weeks is full term. It can also be considered at 41. 40 to 42 is late term. And so anything after 42 weeks we consider to be post-term. So here's our kind of general timeline, and this is going to help us figure out the viability of a pregnancy, and it's going to help us define our terms of abortion versus delivery. So going into these terms, the term abortion is often used to refer to killing babies. This is not the case. The term abortion does not have none of these terms have anything to do with killing the fetus. That is not the goal of any of these. The thing is the pregnancy continuing, or are you ending the pregnancy and at what stage of the pregnancy is it being terminated. So regardless of whether or not the fetus survives the delivery, it's still ending the pregnancy. The fetus is irrelevant here. So an abortion is anything that causes a pregnancy to end 20 weeks or earlier. Because remember, 20 weeks is non-viable. So if we were to end a pregnancy 20 weeks or earlier, it would be non-viable. So you're not going to have a gestation that's going to survive outside of the womb. This is called an abortion. And there are a couple types of abortion. So if you've ever heard of someone having a miscarriage is a spontaneous abortion because it's a pregnancy that ends earlier than 20 weeks or at 20 weeks, but it's spontaneous. So nobody did anything to cause this. More commonly, spontaneous abortions or miscarriages are caused by genetic defects or anatomical defects within this early stage. And that would be a spontaneous abortion. And then the other type is, this is the one that's really contested, is medically or surgically induced abortion. And again, this has nothing to do with using medicine or surgery to kill the fetus. What you're doing here is you're giving medication or using surgery to end a pregnancy 20 weeks or earlier. So if you do that intentionally with medicine or surgery, it is an induced abortion. If it is spontaneous and not planned, it is a spontaneous abortion. So then what happens after 20 weeks? Because 20 weeks is our pivot point here for viability. So a pregnancy that ends after 20 weeks is a delivery, because anything after 20 weeks, you're going to have to deliver. So something earlier than 20 weeks, you can usually clear out the pregnancy by dilating the cervix and going in and kind of sucking out contents or just passing the contents on their own. After 20 weeks, you are calling it a delivery. So this, again, can happen spontaneously or it can be induced. And this has nothing to do, again, nothing to do with if the fetus is alive or not. So if you're delivering, this could be a spontaneous delivery after 20 weeks. And granted, earlier on in this time, those early preterms, extremely early preterms, you probably won't have a fetus that survives. Sure, there is a chance that the fetus could survive after that delivery, but it's still a delivery, and there's no guarantee that baby is going to survive during that time. So you could have a spontaneous delivery where the uterus expels the baby on its own, or you can have an induced delivery, and you can have a delivery that's induced earlier on in the preterm period or in the early term period due to a medical reason, or you could have an induced delivery even at late term, post term, when someone's going into the hospital to get an induction. This is what this is. You are inducing a delivery with medications, usually oxytocin and some other drugs will cause an induced delivery. And this can either be alive or it can be a stillbirth. But either way, whether or not the fetus is alive at the time of delivery, or if it is deceased at the time of delivery, it is still a delivery. So once again, nothing to do with the state of the fetus. It only has to do with the state of the pregnancy and the stage at which the pregnancy ends. So then, really, what we're talking about, when we're talking about colloquially an abortion, we are talking about termination. All right, so a termination is a non-spontaneous ending of pregnancy. So if you had a medically or surgically induced abortion, so if you end a pregnancy 20 weeks or earlier and it was intentional, done by medical or surgical intervention, it is a termination. Same thing. If you have a delivery that is induced, you have a medical reason to induce a pregnancy, that is a termination. You are terminating the pregnancy. You are not necessarily terminating the embryo. You're not terminating the gestation. You are just terminating the pregnancy. So you could end the pregnancy, deliver the baby, because it's after 20 weeks, so it's a delivery. Deliver the baby, and then the baby could still survive, or it could not survive, but that is irrelevant. This is just termination of the pregnancy. So, yeah, this can either be an abortion or delivery. Exactly the same with the above two. If it is non-spontaneous, it is a termination. So a termination can result in a live and healthy gestation. So a lot of people that think that a termination or abortion is killing a baby, it's not, because it's just referring to a non-spontaneous ending of a pregnancy. And this can result in live and healthy gestations. So use of this term to start an argument about baby killing, or that using some pro-life logic, is irrelevant. It's not relevant to this term of termination because it has nothing to do with if the pregnancy, if the baby survives or not. It has nothing to do with that. So one of the main points I'm trying to get at here is that there are reasons, and plenty of them, to terminate a pregnancy to save the parent. So a lot of the anti-abortion, and what they mean by that is anti-termination bills, are trying to say that you should not be allowed to terminate a pregnancy earlier or later than 6 weeks. It can only be done 6 weeks or earlier because that is when the fetal heart starts working. But thinking about what termination actually is, there are conditions where you need to deliver the baby in order to save the parent, and usually also to save the gestation. Preeclampsia is one of these. If you have an inevitable abortion, which is not actually an abortion, it's a rupture of membranes. If you have premature ruptures of membranes, you need to deliver. There are plenty of reasons why you would need to deliver a pregnancy earlier than term, and usually they're for safety reasons. So looking at that again, we'll talk about this later, but termination can result in a delivery. It can be a live and healthy gestation, but you can also need to deliver a pregnancy so that you can save the mother, even if the fetus is not viable. And that is something that we're going to go into later. So I know this was a lot of content to cover, and it's a lot of intense information. And we're going to continue this series. I hope you're going to stick with me through it. Please, if you have any questions, leave those below. If you want to have any debates about this, I'm happy to debate in the comments as well, because this is an issue that is really going to cause a lot of problems. If you have a pregnancy that is harming the parents and usually also harming the baby, and you're not allowing doctors to take necessary steps to save these people, and oftentimes the most appropriate action is to deliver. If someone cannot deliver after 20 weeks because it's considered a termination, then you're risking lives. It's very important to be up to date on this scientific information. So I hope this cleared a lot of that up for you, and I will see you all in the next one.